We're going to talk about sleep with Dr. Mehra in a second, but first, a recent study suggests that over half of adults with mental illnesses go untreated.
So the study by the Mental Health America ranks each state based on mental health and access to services, and access is so important. In the last year, Wisconsin dropped from 8th to 35th place in that ranking. Dr. Mandira Mehra with SSM Health joins us now this morning. Good morning.
Good morning.
So we talk about diagnosis, but also access to care. What are some of the things people should be asking about and thinking about in terms of this issue?
So that's a great question, Adam. And things to think about is this is not an uncommon phenomenon. So this is not a 1 out of 100, 1 in 1,000. This is about 20% of Americans. So we're talking 1 out of 5 will likely suffer at some point in their life from some kind of mental health or mental illness sort of issue. That can be a one-time in life occurrence. It can be relapsing and remitting. It can be many different forms. And so first of all, just awareness of the issue is huge. Now, the fact that over 50% of people are not receiving treatment, so we have the 1 out of 5, and then half of those people don't have access, don't get that treatment, is huge and, of course, alarming because that unfortunately stops you from being able to really function to your full capacity. I think it's much easier for us to really understand if someone's having a heart problem or blood pressure or kind of a physical ailment, because sometimes we can't see necessarily the mental manifestations of something.
I think kind of debunking the stigma around this as well is so key. I mean, there's nothing wrong with having a mental health issue. It's common. You don't have to be I mean, you don't have to be scared about it, and you don't have to be ashamed about it.
Exactly, and you know, along those lines, I think we're much more accepting sort of historically to say, okay, well, if I have high blood pressure or a heart issue or whatever, I'll sort of seek help for that. So in this similar light, I think people should be willing and accepting to say, if I need help here, let me seek out help. Now, of course, like you were mentioning, in different states, there's different access issues, and this is something that is political, it's medical, it's scientific. So of course, trying to gain access is always helpful. Luckily, we do live in a technological world where we don't just use Google and YouTube for kind of entertainment purposes, but definitely talking to your doctor, asking about even some self-help methods online, community access, that kind of thing can be very helpful.
We have about a minute left, and switching gears completely, we've been talking a lot, reminding people about daylight saving time ending. There are some hard adjustments for some people.
Exactly, so kind of along that same line, this can be a tough time for people. People get seasonal affective disorder, maybe you just miss being outside as much. So it is getting darker earlier, and then this weekend we will be, you can look at it as kind of gaining an hour. So some tips for people to do, the 7 o'clock a.m. now will actually be 6 a.m. So instead of sort of sleeping through that hour, maybe making that me time, maybe making that a time where you could get in a morning workout. Really trying to avoid naps is also a helpful way to sort of adjust to this.
That's funny, Dr. Mehra.
Yeah.
That's funny.
I know, I'm guilty as well, but also eating dinner before bedtime, having a nice bedtime routine. I know Adam was mentioning this is a hard time for the kids too, because they get very used to a schedule. So any kind of gradual, incremental changes that you can make to kind of help them adjust is always great.
Good advice. Dr. Mehra, good to see you.
Nice to see you.
Thanks so much.